Hi, I am Dr. Santosh Betu. I am a lead consultant in the Department of Urology, Aster RV Hospital, JP Nagar. Today, I will talk about one interesting topic. It's one of the common problems in women. It's called incontinence of urine, or in other words, involuntary leakage of urine without one's knowledge. It is very frequently observed in women of childbearing age or women we have born multiple children, or even after single pregnancies, and also in women of advanced age. So, whenever somebody comes with this complaint of leakage of urine, we typically ask one simple question. So, something like we call it as stress incontinence, where the people will have, or the woman will have, a leakage of urine when they cough, sneeze, or try to lift some weight, or when they are getting up from the bed or changing posture. Sometimes its severity may be to an extent where even the minimal movement of body will cause leakage of urine. Another question we ask is whether they will have anything called urgency. In urgency, the moment they get the sensation to pass urine, they immediately have to go to the toilet. Or in case if they are not able to reach the loop before passing urine, there is an involuntary leakage of urine. This we call it as urge incontinence. So, whenever a woman with these complaints meet me, I always have to differentiate between these two, called stress incontinence or urge incontinence. This is one of the most common or a very common problem in women. Most of the women, they think that the problem will not have no solution, and many things they think these are all common things, which I have seen them bearing these problems for 15-20 years also. Whenever they discuss this problem among themselves, most of the women will agree that almost nearly 70 to 80% will have these complaints, and they will pass this off as a normal physiological thing. But this is a problem. This is the common reason being, if somebody is having an urgency, it can be as simple reason like an urinary tract infection, or sometimes we call them as overactive bladder. There are very simple medications available which we can start to an extent that they will give a relief of more than 95%. Another common thing, as I explained, is something called stress incontinence. Stress incontinence happens because of the weakness of pelvic floor muscles. It happens during childbirth. It's a normal vaginal delivery or some other form of instrumentation. The pelvic floor muscles are stretched due to the baby inside the womb, and during the childbirth these muscles are stretched. They may not get back to the normal tone when in the immediate postpartum period. So, whenever somebody comes with this stress incontinence, we ask them about the severity of incontinence, like whether it is few drops of urine which leaks out, or a few ml, or sometimes even some people they say they empty the bladder completely. Depending upon the severity, we suggest them treatment, like simple treatment like physiotherapy, or we call them as Kegels exercise. This is routinely prescribed by their gynecologist after the childbirth, and in our urological practice, we recommend this physiotherapy for a prolonged duration like 6 months to 1 year. When they do this Kegels exercise, simple pelvic floor muscle exercise, it will improve the tone of the pelvic floor muscles and significantly improve the leakage of urine. If the pelvic floor muscle exercise are not sufficient, then there are some medications we prescribe, the simple medications, and nearly 70 to 80% response is seen with these medications. If there is no response to medication and this Kegels exercise, then we do have surgeries. We call them as tape surgeries. We have an external implant which will support the urinary tract, or to strengthen the pelvic floor muscles, these synthetic materials are used. A very simple procedure which can be done as a daycare procedures. People have to stay only for 12 hours to 18 hours in the hospital. They can go back home, and very minimal recovery time. Having said all these things, my advice for the people listening to me is, don't suffer in silence. I have seen people going into depression, their social life is affected because of this incontinence. There is a treatment available, not just one treatment, there are multiple options are available. You may not need a significant surgical intervention. It can be because of as simple as a physical exercise. So, don't suffer in silence. My advice to all those people you are listening to me, if any of you are affected, you can consult me at Aster RV Hospital, JP Nagar.